Hello. Hello, I am Dr. Suhas Patil. I am a general surgeon and mainly I am specialist in general surgery, laparoscopic surgery and laser proctology. I practice in Pune city and Pimpri Chinchwad city. So today we'll be dealing with very common topic that patient comes to us. Though that topic is a body tumors. Every young patient or alternate we face a patient who has a body tumors over his body. What are the body surface tumors? Patient complains of tumors over their forearm, over their arm, face, chest, back, thighs, abdomen, everywhere. And patients are very anxious whether this body tumor is cancer or it is something else. So first of all, we'll just discuss what are various types of body tumors. The common body tumor is lipoma, sebaceous cyst, fibrolipoma, ganglion. These are very common body tumors. Now, when patient comes to us that I am having swelling over my arm since so days, but typical patient complains there is no pain or the swelling, but swelling slowly increasing in size. So on examination, that swelling we diagnose it as a lipoma. Now, what is lipoma? There is a fat beneath our skin all over the body, and lipoma, by definition, is a benign tumor of fat cells. So wherever there is a fat, some fat tissue grows extra, and that forms a tumor, which we call it as a lipoma. Patient when comes in our OPD, first of all, he is very anxious. Doctor, whether this tumor is simple or carcinogenic or cancer. So first of all, I'll like to take out your fear that lipomas are not a cancer. Lipomas are benign, means non-cancerous tumors of our fat cells, and be assured those are not cancers. But the next question arises, what is the cause of lipoma? How it occurs and what is the treatment? So first of all, when patient comes to OPD, we examine the patient and lipomas can be diagnosed on just examination by surgeon. When we touch the tumor, when we examine the tumor in details, we can clearly diagnose lipoma on that examination only. There are again few investigations which we need to augment our diagnosis. Those are sonography and MRI. Now, in which case we should do sonography and MRI? Suppose lipomas are very big in size. Big in size means it is more than 6-7 centimeter. And if lipomas are located at critical places like at the back, if it is over the head, in such cases we do MRI. Now, see, as I told you, lipomas are not cancerous tumor, but there are 0.5 to 1% chance that those lipoma may convert into cancer. So next question arises, what is the treatment plan for lipoma? Many patients ask us whether can we apply some sort of oil or whether we should do the heavy exercise, will that cause lipoma to disappear, or whether we should take any ayurvedic or homeopathic medicines. So for your information, there is no medical management for lipoma. I mean, it cannot be cured with any kind of medicine. So there are only two options. One is you live your life with that lipoma or just take it out. So what are the conditions where we strongly advise that these lipomas should be excised or operated? So first is when there is an increase in size of lipoma. Suppose patient has that swelling around 2 to 3 centimeter, but he finds that the swelling is slowly increasing in size. So that is a clear-cut indication for the excision of lipoma. The reason behind this is, though lipomas are non-cancerous tumors, but in some rare instance that lipoma may turn into cancer. So when there is an increase in size, we should suspect that. And in that case, we advise our patient to please take it out because it is increasing in size. This is the first indication. Second, if it is causing pain, few patient comes, I have this tumor since many years, but recently I am getting pain or the swelling. So what should I do? So I would recommend, rather than taking any kind of painkiller, if it is paining you, there must be some infection or that fat tissue might get distorted. So in that case also we advise our patients that we should take it out by small surgery. And third important thing is, if it is disturbing you cosmetically. Cosmetically means in case of females or in case of young males, if there is a lipoma over the forearm, arm, and those are a big size, irregular one, so that may create a cosmetic disturbance. So in such cases also we advise our patients that it should be taken out. And fourth is for psychological purpose. few patients are very anxious. Even we assure them that these are not cancer. Instead of that, they are very much worried whether it is cancer, and they search on Google. They get various kind of information. So in that case, also we advise that better if we take it out, because once the tumor is out of body, you will be also assured. And after taking the tumor, we send it for a microscopic examination. That also proves that it is a normal or some different kind of tumor. So in these three conditions, we advise our patients to take out the lipoma. So this is a treatment for lipoma is only surgical. There is no medical management for lipoma. Second most common tumor that we encounter in OPD is sebaceous cyst. What is sebaceous cyst? Sebaceous cyst is the tumor which arises from the root of the hair follicle. So remember, we have hair follicle, hairs almost all over the body. So where there are hairs, there can be a sebaceous cyst formation. This is also non-cancerous tumor. And as in case of lipoma, sometimes lipoma may rarely turns into cancer, but sebaceous cyst never turns into cancer. Then what are the complications if we do not operate on sebaceous cyst? If it remains for a long period, it may cause, there may be some infection, and because of infection, there is a pus formation, and the swelling again, the tumor again becomes swollen. So in that case, we need to operate. So when a patient of sebaceous cyst come to us, again we can diagnose sebaceous cyst just by examination. But when there is some doubt, we advise some sonography or MRI. But sebaceous cyst, it is clearly diagnosed on examination. Now, if patient comes to me for sebaceous cyst, I will advise my patient that it is to be taken out. We should not observe this tumor, because sebaceous cyst in future is going to infect, or it is going to increase in size, or it is going to trouble you. So better once we find that we are having sebaceous cyst, we should take it out. Again, it is a non-cancerous tumor. Now, these are the most common tumor that we find in our OPD. Then third surface tumor, which is in case of females, is a breast lump, tumor in the breast. Nowadays, breast tumor is very common, and there is no age bar for this. Previously, breast tumors were common after the age of 40, but now it is common right from the age of 14. In case of breast tumor, there are two types. One is cancerous, one is non-cancerous. So again, how we will come to know that the tumor is cancerous or non-cancerous? So first of all, from the patient perspective, if patient notice any kind of tumor in the breast, patient should not treat that tumor at home, or patient should not ask any of relatives, I have tumor, what should I do? Should I wait for a few days? Should I wait for a few months to regress? Please don't do that, because breast cancer nowadays is becoming very common, and no age is bar. Previously, breast cancer was common after the age of 40, 50. Now it is very commonly seen after the age of 30 also. So if you notice any tumor in the breast, please consult your doctor, because after examination we will come to know whether it is cancerous or non-cancerous, and then we'll advise some test to confirm our diagnosis. So breast tumor, every person, every female should check for the breast tumor at home. Every Sunday, maybe they check for it, and if they find any tumor, they should visit the they should visit the concerned surgeon. Now, what is the treatment of breast tumor? Most of the breast tumors are non-cancerous, but they may increase, the non-cancerous tumors may increase in size, they may cause pain during menses. So in that case, we need to take it out. And most important, there are few breast tumor, even with examination and with sonography, with all other advanced tests, we cannot confirm that it is a not cancer. So in that case, we need to take that breast tumor out, and we need to send for microscopic examination. That gives us the tissue diagnosis, which is almost 99% correct. So breast tumor should be taken out. That is important thing. Unlike lipoma, we can wait for a few days, but if you find any kind of breast tumor, it should be taken out. So after these three common tumors, there are some rare tumors. One is liposarcoma. Liposarcoma is a cancerous conversion of lipoma into liposarcoma. In that case, it's a clear-cut cancer. We advise MRI, and we plan a big, one of the radical surgery. It's not a simple surgery like lipoma. Now, as far as the surgical point of view is concerned, surgery for lipoma is a routine, or it's a simple procedure. It can be a daycare procedure. Morning you can come, and most of the lipomas, if they are small enough, less than 3-4 centimeter, they can be well taken out with under local anesthesia. So same day, maybe after 2 hours of excision of tumor, you can be discharged at home. And nowadays we apply dissolving stitches, or we do it by the laser suction. So once there are dissolving stitches, you did not take out the stitches, and there will be no scar also. So these are the advantages of the advanced surgeries for the lipoma. Same is the case of sebaceous cyst. In case of breast lump, we need to give a anesthesia for breast lump. That can be some sort of general anesthesia, because if the tumor size is big, we need to give general anesthesia, and it is also taken out. And in that case also, there is almost minimal or no scar after taking the breast lump. The other body tumors which are relatively less, but those can be neck nodes. Few patients comes to us, there are some swellings in their neck. Those are also very common in India. In India, the common causes for the neck swellings are infection. First is any kind of sore throat, any kind of tonsillitis which is not responding to medicine, that will cause a multiple swellings in their neck. One cause. Second is tuberculosis. In India, tuberculosis is very common. So when patient comes to us with the swellings in the neck, our first suspicion is tuberculosis. So in that case also, we strongly advise for the excision of the that swelling and its microscopic examination. In swelling of the neck, we may go for the sonography of neck, in which they diagnose the exact tumor size, where it is located, whether it is deep seated or it is superficial, what is the nature of tumor. And after that, we take out the that swelling by small surgery, and we send for the examination. If it comes just infection, we give some antibiotics, it gets cured. But if it turns to be a tuberculosis, we need to go anti-tubercular treatment for almost 6 to 8 months. That cures the disease. The rare causes of the neck swellings are the some sort of cancers. We call it as a lymphomas. Lymphomas are the discrete lymph node tumors that are seen all over the body. So in that case, we need a excisional biopsy. So if it is a neck tumor, we should go for the biopsy. We should take it out. If it is lipoma, as I said, if these three things are there, if it is affecting you psychologically, we should take it out. If it is sebaceous cyst, we should take it out. We should not indulge into the medicine, because there is exactly no role of any medicines for these tumors. The other less tumors are, you can say, hydrocele. Those are the tumors of the scrotum, tumors of the thyroid gland, but these are rare tumor, and these need to be tackled in a special way. Okay. If you have any questions regarding this, you can ask me. Okay. So now about piles, there are two varieties of piles. One is internal piles, which is inside anal canal, and one is external piles. So internal piles, if they are grade 2 and more than that, we definitely advise surgery. What about external piles? Now, external piles, generally they can cause pain in future, and if there is some swelling that occurs, what happens in external piles? If you have a constipation and if you strain a lot, that time some of the external piles may get swollen, and those piles become infected, pus formation. So if any patient comes to me with external piles, and if he is having complaints of it, then I would definitely advise surgery for that patient for the excision of external piles. See, now there are various tales about the piles. Many patients, when comes to us, they are in a fearful and in some wrong impression. After examination, we tell the patient, you are having piles. We advise patient surgery. But what is the first question of patient to us? कि डॉक्टर पाइल सर्जरी का कोई कॉम्प्लिकेशन तो नहीं होगा ना, ये फेल तो नहीं होगा ना. That is a very spontaneous reaction of the patient. But trust me, those days are gone. Maybe before 20 years, we used to think that, oh, pile surgery is something which is very painful and it goes fail and even patient becomes worse. These are all just tales that everybody tells. Pile surgery nowadays are very advanced with the help of laser, with the help of staplers. In fact, the techniques are also very advanced. So be assured, you have complaint of piles, and if doctor is advising you surgery, So get done, because advanced surgery will not cause you that much pain which conventional surgeries. I always tell my patient, if conventional surgeries cause you 100 pain or 100 bleeding, this advanced surgery will just cause you 2 to 5 pain. That's it. And that can be also tackled with medicine. So please go ahead with pile surgery. And nowadays there is no success, no failure. It is always successful. But one important thing, what happens generally when we have piles now, we keep on postponing it. Or we'll take medicine. In that case, what happens? Patient comes to us when it becomes right to grade 4. So when piles are grade 4, when things are complicated, at that time, if you get operated, definitely it will cause some pain. So what is important tagline is, if you get done pile surgery operated at right time, you will be definitely pain free and symptom free. Now, in some cases, just patient comes to us that there is a doctor, there is no bleeding, but I have a constipation and I get some sort of discomfort there. So what it could be? Now see, I will tell you just grossly. uh, Symptoms of piles is bleeding, which is most of the time painless, and symptom of fissure is intense pain and it bleeds also. So if someone is having no bleeding but just pain and constipation, in that case what happens? Sometimes piles mass may block our anal canal, and when we pass motion we need to strain, and that straining may cause pain and discomfort. So in some instances, patients is having piles 2 to grade 2 to grade 3, but still that patient may not be having bleeding. So kindly check. Don't think I'm not having bleeding, I'm just having pain, so I don't have piles. Don't get into in that impression. Sometimes you may have piles, but it's not always necessary that it may bleed. Maybe in future it will worsen from grade 3 to grade 4. It may bleed. So generally, this grossly I can tell you, if it is bleeding without that much pain, it's a piles, and if it is just pain, severe pain after passing motion, it's a fissure. Now, one thing, see, when we call it as a piles, we take it as just a piles. See, proctology is again not a simple branch, it's a vast branch. There are various terminologies, there are various diseases. Piles means some mass is there inside our anal canal which bleeds. That is a piles. Second is fissure. Fissure means simply a crack. It's, we can call it a wound, lacerated wound right at the anal verge. That is a fissure. And third is a fistula. Fistula means there is some formation of some sort of tube which has two openings. One opening is just close to anal opening, and one second opening is inside the anal canal. These are the fistulas. So we cannot categorize all these diseases into single one like a piles. Suppose if you got operated for fistula 20 years back or 10 years back, that time you were operated for fistula. So your fistula has got cured. But maybe after 10 years, due to altered lifestyle, due to your other factors, you may develop piles. So in that case, if patient comes to us, ki, I had been operated for fistula 10 years back, but now I am getting piles now, how it is? So these are two different diseases. So we cannot tell it as a recurrence. If it is a piles now, we need to treat that piles separately. Okay. See, now as I told you, okay, if you have hemorrhoids since many years, maybe with medicines those hemorrhoids may get suppressed for time being, but after 6 months, 1 year, 2 years, again they are flaring up. And if it is at a young age like 22, 25, 30, that time I would honestly advise that you should get done surgery. Don't think of recurrence. If you get it operated in right time, there are almost nil chances of recurrence. If someone is having hemorrhoids piles since 11 years, and now those piles gradation is changing, if it is from grade 2 it is becoming grade 3, grade 4, and along with that there is some external component of piles also, so get done surgery. I'm telling you, nowadays these surgeries are very safe, without any failure, without any complication, and patient can resume their duties as early as possible. There is no need for a long-term dressings to be applied there. So please be assured that if you are having piles, if your surgeon is advising for the surgery, get it done. Don't think of any hesitation regarding recurrence or regarding any complication. These are the safe surgeries nowadays. Okay. Now, just I said you, if someone is getting operated for some one thing, for example, if someone is getting got operated for got operated for fistula, and that patient is complaining of some mass is there or that region. So it need not necessarily that is a fistula which has occurred. If there is a something mass which is feeling like a piles, that can be a piles, because these three four are the different diseases. Piles is different, fistula is different, fissure is different. So it may happen that if 20 years back you got operated for a fistula, but now you have complaints of some other things, that can be a piles. So we need to get operated for piles, isn't it? So these are different diseases. Make a note of it. It's not a piles. Generally we use a vague term for piles, but if you got operated for a fistula and now your symptoms of piles, so it's a different piles that you have occurred. So please get treated for that piles. Don't think that fistula has recurred for you. Okay. Now, what is, see, I'll just explain one of the very small disease regarding this piles fistula, fissure. If in a layman's language or in general person language, we can call it as a fissure, means a crack. As we get a crack over our soles and over our soul, we get a different kinds of cracks. So same crack, if it is occurring at the anal opening, at the very mouth of anal opening, we call it as a fissure. Now, what is the difference between the fissure that has that occurs on other parts of body and at anal canal? See, for any wound to heal, we need a lots of blood supply. So if you have wound all other part of body, it heals rapidly because there is a lots of blood supply. But what happens in case of fissure in ano? If there becomes a wound may be because fissure may cause because of constipation. If you strain a lot at the time of motion, if you are having a lot of spicy food or outside food causing indigestion, if you are traveling outside and that has disturbed your lifestyle, if you are not sleeping early in night, if it is your sleep is very less, if there is no fiber in your diet, all these things can cause fissure to you. Now once it happens, so what is the treatment? Fissure at the anal opening doesn't heal as easy as the wound of or the other part of the body, because when we go for the washroom in the morning, it creates a pressure at that point at the anal region. So first is it is a pressure point, so any wound at the pressure point, it won't heal so easily. Second, all the fissure wound is present at the contaminated part of body, isn't it? That fissure gets contaminated daily because of fecal matter. So again, any wounds needs to be clean for healing. So fissure in ano doesn't heal so rapidly as other wounds. And third is because of fissure, anal opening gets shortened. I mean, get narrowed. But those having fissures, they can notice that when they pass motion, they need to apply pressure, as if there is a very small opening and they have to apply lots of pressure to pass the motion. This is because fissure causes a narrowing of anal opening. So once there is narrowing of anal opening, the blood supply to the fissure wound gets decreased, and again this doesn't help for the wound to heal. So fissure we divide into two categories. One is acute fissure, which is of short duration, I mean which has formed within a 2 to 3 weeks hardly. And second is a chronic fissure. Chronic fissure means which is there since many months or many years, but it is troubling you. So for acute fissure, if patient comes very early to the surgeon, that time with medicine acute fissure can heal. With medicine it can heal, but again the chances of healing are 50-50%. In 50% cases of acute fissure who report immediately to surgeon, medicines responds well, but again some 50% they have partial response with medicines. In that case we need to operate. And the second category is chronic fissure. I mean those who have this problem since many months, many years, they have to take some laxative, stool softener, and if you they don't took any stool softener, again they get a problem of this. In such cases we always advise a surgery, and with surgery they get a dramatic relief, and there is no pain, there is no need to strain, and there is no need to take a laxative for long time, no need to take a stool softener for long time. Okay. Now one important thing is how these diseases can be prevented. I mean, I'm just telling you the causes, progress of the disease, treatment of the disease. The smart question is how these disease can be prevented. This is very, basic question. So first we'll why this occurs. Now the only word I can tell you, lifestyle, lifestyle, lifestyle. It is due to altered lifestyle. Nowadays the world is very fast. Everyone is in hurry. Everyone has to catch the bus. Everyone has to reach the hospital in time. Everyone has the lots of workload. In that time we forget our lifestyle. First is outside food, fast food, junk food. That is the important factor. Second is timing of our lunch and dinner. We should be taking our lunch and dinner in that time only. If it is we are taking our lunch at 1 p.m., it should be 1 p.m. only. If we are taking our dinner at 7 p.m., it should be 7 p.m. only. But what happens, we take our lunch one day 1 p.m., next day 2 p.m., 3 p.m. because of our work schedule. So that has an altered lifestyle, and that definitely leads to this condition. Third is water intake. We should have a lots of water intake. We can say almost 3 liters of water that we should have daily. Fourth is fiber diet, the quality of food that we are having, whether that food is good quality, whether that food is digestion friendly. So we should have a fiber rich diet. For example, tomato, cucumber, and lots of salad should be there. Then other thing is spicy, oily, as I told you. A good quality of sleep, stress free life. We should have a good 6 to 8 hours night sleep that will reduce our stress. And stress is definitely a important factor of our piles and fistula. So one should have stressful life, how to manage stress. Other thing is our sedentary lifestyle. We used to sit in office for a longer period. That is also one of the cause. So we should keep our body dynamic. We should spend at least 40 to 60 minutes daily for brisk walking, for any kind of warm up aerobics. I won't suggest that you do heavy gym, but you should be doing brisk walking also will do, warm up will also do, yogas and pranayam will do. So at least for 40 to 60 minutes, if you do these things, if you follow proper lifestyle, I think you will be away from the piles conditions. Okay. So almost we have gone through the basic details of piles, fistula, and fissures, and we have also seen body tumors, lipomas and lipomas, sebaceous, breast lump. So no one should fear of this. If you are coming to a surgeon with piles, and if someone is advising you a surgery, these are the nowadays advanced safe surgery. So don't think much and don't sit at home thinking that I have piles and I'm ignoring or I'm hiding it. Because if you ignore, if you hide, the grade of pile will keep on increasing from grade 2 to grade 3, grade 3 to grade 4, and it will really become difficult. That time surgery, the method of surgery will be also bigger, wound will be bigger, patient will suffer. So if you are experiencing any symptoms, please consult your surgeon without any hesitation. Okay. Thank you.